London leaves indicating signs of a change in season. But it isn't just the drizzle dampening spirits as the UK heads into autumn. With around 34,000 new COVID infections a day and 1,000 deaths in the past month, the British government's message is clear as it sets out its plans for what's anticipated to be a tough winter for the health service.
COVID is still out there. The disease, sadly, still remains a risk. But I'm confident that we can keep going with our plan to turn jabs into jobs, and protect the gains that we've made together.
With children now back in classrooms for the new school year and the delights of summer al fresco dining already fading, variants of the virus, Delta or otherwise, will continue spreading. But with new data showing the vaccine's solid success at preventing death and severe illness, jabs are at the centre of Westminster's rollback of emergency restrictions and their optimism that further lockdowns can be avoided. Within days, people over 50, younger, vulnerable people and health workers will be offered a third shot if 6 months have passed since their second, and 12 to 15-year-olds will be offered a single Pfizer jab to minimise disruption to education more than due to concerns for their health.
Almost 99% of COVID-19 deaths in the first half of this year were people who had not received both doses of a COVID-19 vaccine. This shows the importance of our vaccination programme, and by extending this programme further, we can protect even more people.
Ministers have already shelved plans for so-called vaccine passports to enter venues in England for now, but are keeping them in reserves if matters move in disturbing directions. Mask mandates and work-from-home directives are also in their back pockets, what they're calling Plan B.
If all those control measures are being put in place, maybe we will have a little more control onto the pandemic itself, which will help the NHS to cope with other infectious diseases as those move along. However, it is not guaranteed how much scale we will have because we have relatively little time. So this means vaccines alone cannot be a real bet for reducing the impact of the pandemic. We need to consider other measures to reduce the transmission. And one best measure we can reintroduce is really the masks.
As the nights draw in, COVID-19 will be harder to hide from. Leaders are banking on science and continued public support to mitigate this still very dangerous disease. Paul Barber, CGTN, London.